All right, you're up.
So, my name is Alexander Karanjang, and I'm for the affirmative for physician-assisted suicide and why it should be available for all Americans. I gotta get a definition out of the way. It should be noted that there's a difference between physician-assisted suicide or physician-assisted death and euthanasia. Physician-assisted death or suicide, PAD or PAS, which will be referred to from now on, is when a doctor prescribes a medication that a patient will use at their own discretion, whereas euthanasia is a doctor directly ending the life of a patient. Currently, PAD is legal in many states, including California, Oregon, and Vermont. Euthanasia is not legal anywhere, so all of the evidence and argument will be about PAD. And so it begins. People are being left to suffer for what appears to be nothing more than misplaced good intentions. I'm going to tell you why this is, why it's important, why the status quo is what it is and why it's not changing, and what we can do about it. So, why it's important. People should be allowed to choose what they believe to be the less sufferable option. I have a first account source from the Death with Dignity Act for the mesothelioma official page. They had an account of a woman, Brittany Maynard, a 29-year-old with a 6-month prognosis of brain cancer. And she believed that she had the right to die before her disease could kill her. Her case attracted media attention with the Death with Dignity Act and the political spotlight. She said that no treatment existed that could treat her, and she considered herself lucky enough to move all the way to Oregon, where PAD is legal, where she got the prescription. So that's why people should be allowed, because like they're going to do it anyway. Why people aren't changing? Well, the reason why the public is yet to move on the issue is because, as some of you can feel, death, or rather letting someone die, seems inherently bad. It seems particularly counterintuitive to the Hippocratic Oath. So why should we go against that? Well, physician-assisted suicide is controlled to only allow for people with circumstantially clear mind and autonomy and no other options. From the same source, I have the terminally ill patient's right to die, like the prescription requirements. In order to have a prescription in Oregon, Washington, or Vermont, patients have to have a terminal illness with a 6-month or less prognosis, be an Oregon, Washington, or Vermont resident, be 18 years or older, and be mentally stable and able to make decisions on their own behalf. So you have to have a clear mind to do this. There's no mentally ill people like going and trying to like hurt themselves. These are people who are suffering and dying. And again, and thus seen in states like Oregon or nations such as the Netherlands, physician-assisted death is inherently transparent. It's a transparent, what's the word? It's a transparent like idea. It's the system itself like calls for people to just be open about like what they want, and it gives doctors the discretion to do what they want. Physician-assisted suicide is controlled. Oh wait, sorry. Physician-assisted suicide is controlled to only allow for people with circumstantially clear mind, and not only that, it sorry, scratch that last part. The physician's experience with organ death, this is what doctors have been saying, and this is like their point of view. So for the New England Journal of Medicine, written by Dr. Linda Genzani, she did a study. They found no evidence that any vulnerable populations were at risk, and any alternative health plans presented to patients, such as palliative and hospice care, often gave patients an alternative route for continuing with the death with dignity request process. And what we can do about it. So legalized physician-assisted death or physician-assisted suicide is, we can see it. It's available in other states and other countries. According to the Quality in Death and Dying Patients report by the same source, Linda Ganzini, the Journal of Palliative Medicine, they made the conclusion that the quality of death experienced by those who received lethal prescriptions is no worse than those not pursuing PAD. And in some areas, it is rated by family members as better. And doctors are willing to corroborate this. With the Oregon Hospice Chaplain's experience with patients requesting physician-assisted suicide by Ann Jackson and the Journal of the American Medical Association, the Oregon Hospice Chaplains are divided in their views. They don't necessarily agree, but they understand the importance to deliver what the patient wants. And what we want to do, our plan of action, is supported by these claims. If we were to have PAD legalized throughout the country, we will reduce suffering to those who would voluntarily choose on their own terms.